Would you tell us the story of your mother and mother-in-law?
Yeah, my mother-in-law was on her third heart attack, a third bypass.
Ooh, so that's
Yeah.
not just, yeah, it's third open heart surgery.
Well, coronary bypass, open chest surgery for sure. They're
Yeah,
replacing
sorry, I meant, yeah,
coronary arteries,
right.
and she had developed really a significant sarcopenia. So she had moved from the cane to the walker, and then she was standing in her kitchen, and she turned because of her instability. She fell on her tile floor, and she fractured her humerus and her clavicle and her pelvis, and was in rehab for 3 months. And it all dated back to what a gerontologist told us senior medical students in 1968. They said, "You folks know a lot of diagnoses. You're University of Michigan senior medical students. Let me tell you what's really happening to old people. They're losing their muscle. They can't stand and walk with stability. They fall on their osteoporotic bones, and they die from a fracture of the hip, and
Mhm.
or they're losing their mind, and they can no longer function with their families." So what was back to what your focus is? This is big fun for me, by the way, Leland, to talk to a real comrade in arms here. the This is what happens to old people. People in their 50s, 60s, they don't often think about, well, what's my life going to be? Yes, I had to assist my mom into the nursing home, but that'll never happen to me. Or they're not thinking this clearly.
There's a
And
denial.
yeah, and most people, very often, we're just paying attention to what's really right there in our face. What am I doing today? And all this stuff is so consequential. To lose your muscles because you lost your androgens, to lose your mind because you can't think clearly, and lose the women to lose their vagina, men to lose their erection, lose your bones, lose your arteries. That's how powerful these hormones are. Whereas replenishing of them is a sweet process. It's a process, not that hard. And so it's a big deal. It can really make a difference in staying at home for your whole rest of your life, and walking and talking and thinking, which I find everyone wants to do.
How
When
about
they're
that?
rocket surgery, right? I find when an elderly person is facing the reality that they're entering into a assisted living facility, it's a shocker when the family can no longer take care of them at home. And so much of that is our doctor says 80% of them, this is preventable. Yeah, there's some dementias that go way beyond just hormones.
Sure. Sure. But any case of cognitive decline in the practice, hormone optimization is something that we urge patients to uh, pursue, at least be open to. And, frequently our progress with them is frustrated. It's slow when they're not willing to try a full uh, protocol for hormone replacement, because they all play a role, and you cannot get by on just one or two. We had the question the other day on a webinar: if you were going to recommend only one hormone to replace, what would it be? But, and Lauren, our nurse practitioner, said, you really can't ask this question and have us give you a clear, strong answer, because there's this symphony of these hormones going on. To the clinician who uses them, it's something of a tragedy to only want one.
That's beautiful.
Yeah. But
Great
what
answer.
was the result with your mother and mother-in-law, if you don't mind my asking?
Well, my mother-in-law, we have a video of my mother-in-law about 3 months after rehab, when I started replenishing hormones for her. She's sitting on a low couch, one of those low leather couches. She's got her arms outstretched, and she stands up without using her hands. That was dramatic. We also have a video of my mother, who was walking with a cane, walk with the cane and then set the cane down and walk towards us without the cane. This was a very big deal for her.
Of course.
Yeah. So, yeah, they're powerful, they're dramatic, they're not everything.
No, they're not everything.
But they're a big deal.
Absolutely. They could, well, that's, I think, part of why there was such a concerted effort to discredit them intellectually, which hasn't really been borne out in the literature, as you've mentioned and documented in your book, and as we're going to go over in Estrogen Matters.